Good morning, everyone. Sorry, I know it's been a long morning, but we've got this one session and then it's straight into lunchtime then. So we're nearly there. But first of all, a really big thank you to Christian Busky and Paul Kitchen there for that really informative session that we just had. Obviously, we just had that really interesting discussion there about the treatments and the current landscape in WM. And it's really interesting to hear what's out there, what's up and coming. I think it's really important to also sort of bring it back and understand the patient perspective as to people who've had these treatments and their experiences on it. So my name's Alison. I'm the Chief Nursing Officer at WMUK. So it's really lovely to see you all here, and also those at home, thank you so much for joining us. What I want to do is we've got a really great panel here of patients and Beth, our nurse, and I want everybody to have the opportunity to sort of introduce themselves, give a bit of history as to what treatment they've had, where they're at the moment. And I'm going to first of all go to Jeannette here, who, we're very grateful that everyone's joined us. But Jeannette has came from Chile, so really grateful that she's travelled all the way to be with us today. And she's got her lovely friends here.
Thank you very much.
She's got her friend here who's kind of going to do the translation. So first of all, Jeannette, please can you just give us a brief introduction of yourself and the treatment you've had and sort of what treatment you're on at the moment?
Okay. Hello, everyone. My name is Jeannette Quiroz. I am 47 years old, full-time working mother, and a support group leader from Chile. I was diagnosed with Waldenstrom at the age of 36 in 2014. This diagnosis came after routine tests revealed abnormal results leading to a bone marrow biopsy that confirmed the condition, and I was subsequently on the watch and wait list. I began treatment with Velcade and rituximab in 2017 under the guidance of the Dr. Castillo of Dana-Farber, Boston. In 2022, after a relapse, I underwent further treatment with bendamustine and rituximab and had stem cells collected to prepare for a future autologous stem cell transplant. Before both of my chemo treatments, I needed 3 plasmapheresis procedures due to hyperviscosity blood syndrome. Grateful for the support I received, I now lead a support group in Chile, helping others with the same condition while enjoying and cherishing life with my precious son, Mateo.
Thank you. Thank you so much. And so, Beth, if we just come to you next, if you're able to introduce yourself.
So I'm Beth. Before joining WMUK, I worked as a nurse in the haematology day unit in Cardiff. And now, as Alison says, I'm the support nurse for WMUK.
Thank you. And then Jitendra.
Good morning. I'm Jitendra. I am only 77 years old. By background, I am a physician, and I was privileged enough to work as a general practitioner and a hospital practitioner. My journey with WM started really in 2008 when I was being investigated for prostate hypertrophy. And at that time, my blood picked up abnormal globulins. Reflecting back, I had a blood test in 2005, again, which showed a mild rise in the globulin, but to be honest, I didn't pay much attention to it at that stage. However, when the second result came in, I also noticed that my inflammatory markers were going up and also that my hemoglobin was falling. So I started on my investigative journey myself, being a physician. And to be honest, my colleagues knew very little about WM besides myself. So I had an investigation at my local hospital. I went through a bone scan. I had an analysis of my globulins. And it showed high uptake of tracer elements in my vertebrae and my long bones. And there was a query about raised Benz-Jones proteins. So this really got me worried. So through common context, I ended up at UCLH under Dr. Shirley's care, and I underwent a bone marrow examination. And that is when I was diagnosed, a confirmed diagnosis of WM. However, while I was being investigated, I suddenly lost eyesight on one eye. I was completely blind one morning. I got up and just couldn't see through one eye. And having researched WM on my own for a while, I got slightly worried and saw my local consultant ophthalmologist. I said, oh, yeah, you may have raised paraproteins. So shifted me up to UCLH again to see why plasma viscosity causes blindness as well. So I was all prepared for plasmapheresis, and then my colleague came back and says, oh, no, it's glaucoma. Now, I have a very strong family history of glaucoma. My grandfather was blind because there was no treatment available in his days. My father had severe glaucoma, so I could understand why that happened. So fortunately, I did not have plasmapheresis. So for 1 year, at that time, we were calling it watch and wait. So I was on watch and wait. And again, that idea seemed very strange for a physician or the general practitioner. Sees a sore throat, gives antibiotics, off you go, treatment straight away. This sounded very strange to me. However, we bought the idea and went along. A year later, my hemoglobin started falling down. My globulins started rising, and we decided it was time to treat. So I went on the first course, which is rituximab, for the 4 cycles. I did get some remission for 3 years, and then everything started to come back. My hemoglobin fell to 97%. My platelets fell to 65, so things were going down and down. And I had a bone marrow at that stage, which shows 80% infiltration. So we decided to have a second round, and this time I had rituximab plus bendamustine. As you know, if anything were to go wrong, it goes wrong with the physician, not the patient. The physician patients are the worst to treat. Never treat the doctor. So when I started my treatment, I reacted to rituximab, so my dose had to be reduced and prolonged. Bendamustine gave me neutropenia, which is a drop in white cells count, to the extent that I had to drop my dose to 75%. So that took a little bit longer time, and I came through that. We had another bone marrow after treatment, and it still showed 30% infiltration. So the response was not very great. So at this stage, we decided we would add Waldenstrom. And again, after first treatment or second treatment, I had a chest infection. During all this period, I continued to work. I work long days, work from 8:30 in the morning to 9 every day, 7 days a week. So plus I enjoyed a very good social life. I was a very good sports person. I used to play badminton at county level. So I never took any time off during any of this treatment. I was doing a surgery at about 7:30. I went home about 8 in the evening. And by 11 o'clock, I was in ITU in my local hospital. My breathing got suddenly worse. My blood air gases went down. So I was admitted. So again, correspondence between UCLH, where I was in treatment. I'm an ITU in a district general hospital, 60 miles away. So finally, the decision was made that we will postpone treatment for 2 or 3 weeks. And when I came out, the treatment was completed. And fortunately, the bone marrow after that was clear. So at this stage, we decided maybe we should go for autologous stem cell transplant. I agreed, and we started the prep. Again, during preparation, I felt another chest infection. So I was again in hospital for 3 or 4 days. Finally, I had my transplant in 2015. And I've been now on active monitoring, as we now call it.
Thank
So that's where I am. I live a full life. I still play golf 3 times a week, enjoy life as everybody else does. I'm not restricted my activity at all. So here I am. Thank you.
Thank you. And then if we come to you next, Keith.
Oh, thanks, Alison. Once again, I'm also 77, like Jitendra, but we're not twins. We're not twins. My journey started back in 2016 with a routine blood test. It came back with some anomalies, and they said then that they'll pass it on to my local hospital, which is the Royal United Hospitals in Bath. That was in, I say, around about June, and I heard nothing for about 3 months. They said they would triage, and then 3 months later, I had a letter saying, will come in and discuss with us. And all the time, I felt perfectly okay. I went in, and right off the bat, the consultant then said, I think you might have something called Waldenstrom's Macroglobulinemia. And as Bob says, it's all right for you to say, but fortunately, it's WM, so it's not too bad. They then confirmed it with a bone marrow back in November 2016. And since then, I've been started on watch and wait, and now I'm on active monitoring. Blood tests, perhaps every 6 months, then 4 months, 2 months, 1 month. It just depends on how the hospital feels. But 2 months ago, I did my usual blood test on the Tuesday, and then on the Monday, I got a call from the hospital, will you come and see us tomorrow, please? So I went in, and my consultant then said, your hyperviscosity is very high, your paraprotein is very high, and you seem to have lost out on kidney renal function. I think it might be time to think about treatment. Now, Charles isn't going to like this, but I don't look at the figures. I always feel how I feel myself. And I said to the consultant, as I've done over a number of years now, I feel perfectly fine. So she said, well, alternatively, there's DCR treatments, or we could go on to the Rainbow trial, which is DRC versus rituximab plus ibrutinib. But we compromised and had another blood test that day. Went back to see her 2 weeks later, and the figures had started dropping back. And she'd also organised a CT scan for me, so I had that on the day itself. And then I went back another 2 weeks later after another blood test, and the figures had normalised out on what they were before I had the spiked blood test. And looking back, I think I'd actually had an infection. The 3 or 4 days before the bad blood test, whether it was COVID, I don't know, because I didn't bother to test myself this time. I did have COVID a couple of years ago, and it felt the same. 2 or 3 days of feeling just not so well. I went back again last week. I didn't see my consultant. I saw another locum hematologist. So that told me I was feeling better, because usually you're called in to see the consultant when there's bad news. Anyway, everything, CT scan was perfectly okay. The figures had dropped back to usual levels. So we've now agreed that I'll have another blood test in 6 weeks, and we'll see what happens there. I say I'm a quality of life person. How do I feel? I can't believe that treatment will actually make me feel any better, unless I can run the triathlon next week, something like that. So that's where I am, still on active monitoring, and we'll see how it goes.
Thank you, Pete. And then Dorothy, if we could.
I'm Dorothy, and I'm only 72.
Youngster.
I could talk for an hour or more, especially about my treatment, especially after those last 2 interesting sessions that we had. But I better talk quickly, I think, especially as it's nearly lunchtime. So I'll give you the upbeat thing first. I was diagnosed 13 years ago. I'm on my 4th lot of treatment, which is ibrutinib. And I'm feeling great, got lots of energy, and I have an excellent quality of life. So let's hope. The history of my treatment very much reflects what was said in the last 2 sessions. I was diagnosed at 58 with WM, but at that time, the first-line treatment was CVP, but without rituximab because my local health authority wouldn't fund it at that time. And there was WMUK didn't exist then, so there was no one to talk to about any of this, and it was a very difficult time. So I was meant to have 6 treatments, 6 cycles. After the first 2, I felt very poorly indeed. I got pneumonia, was hospitalized. But then I started to develop neurological symptoms, first tingling hands, feet, and then it got progressively worse. I had motor neuropathy, so my legs wouldn't work properly. At my worst, I could only get upstairs on my hands and knees. I couldn't get up off the floor. I had difficulty getting out of a chair without support, and I had to walk with a stick. So that was me at my worst. I was examined by a very good neurologist in Poole, Dorset, but he was a bit baffled by my symptoms because he couldn't understand why they'd come on so quickly and by how severe they were. And in particular, I hadn't noticed this, but he told me to stand up with my eyes closed, and I couldn't. I was about to fall over. I couldn't walk with my eyes closed or anything. I was wobbling about all over the place. So he said he was baffled. He didn't know what was wrong with me, but he thinks he knows a team that did know. And that team is Shirley Desar at UCH and a professor at the National Neurological Hospital in Queen Square. So Shirley agreed to see me very quickly. I went into Queen Square for actually nearly 3 weeks being examined. Then Shirley gave me the news that the WM had actually gone to my central nervous system, and I was going to have some very radical treatment. So I embarked on high-dose chemotherapy, which was grueling, and that involved staying in hospital for 3 weeks at a time. And it was very difficult because I had to go to London. I lived in Dorset. Difficult for my husband. A really, really traumatic time. But it worked. This toxic cocktail of drugs worked even after the first session because I had a drop foot from the nerve damage. And just before I left, after my first cycle, I was allowed to go out for a walk, and I noticed that the foot wasn't dropping the same. And I had 4 treatments in all, and everything progressed as I had more treatment. It was a nightmare. The drug methotrexate in particular, which I call Mr. Nasty, had horrible side effects and bad nightmares and everything. But it was successful, really. I had a very good response. And with the help of my physio, we reckon that my nerve damage recovered by 90%, which is phenomenal, really. And I understand that's because the being ill was identified so quickly after the nerve damage started. So I had 5 good years after that with no treatment. There was a blip in 2016 when I started getting balance issues and headaches and things. And I went back to be restaged again. Interestingly, all this time, there's no paraprotein in my bloods. And in 2016, there was no lymphoma in my bone marrow. The systemic disease seemed to have gone, and I was just left with the residual lymphoma in my central nervous system. So more lumbar punctures, etc., and this showed that number of cells had gone up. But medical views were changing about whether you should really hammer patients with heavy chemotherapy till they get next to nothing. So I had a really good discussion with my consultant, and we decided that better not to treat at that moment, because I didn't really want to go through more chemotherapy. There was nothing else available for me at that time. So I was monitored more regularly, and I was fine. But then in 2018, I had like stroke-like symptoms. My GP referred me to the stroke clinic, but when I contacted Dr. Dazar to come and see me, and straight away I was retested, and there was a significant increase in the cells in my spinal fluid. So there was a bit of a dilemma because ibrutinib wasn't available in the UK at that time, but I could possibly have had it on compassionate grounds. But the trouble was that the burden of disease, which you've just heard about, was really too great to rely on ibrutinib fixing it. And there was still a lot of concern about how well the drug breached the blood-brain barrier. And Shirley, in her wisdom, said, I think we ought to try the chemotherapy again, which we did. I was meant to have 4 treatments, similar treatments, different mix of drugs this time. But I could only take 2 because I was older and I found it very tough, and it was beginning to affect my organs. But the test showed that I'd had a 70% reduction in the number of MYD88 cells, which was very good, especially after only 2 treatments. So it was decided that I should go on ibrutinib to consolidate the good result that I'd had from the chemotherapy. And I'm still on it. Lots of side effects, but in relative terms, not too bad. And I've lost my thread.
No, thank you very much, Dorothy.
No, I need to say something else.
No, absolutely.
I had to say something else because it's good news. I had a blip last year, and the number of cells was going up again. And it turns out I had 3 lumbar punctures and 3 MRI brain scans within the last 12 months. But the lumbar puncture last month showed that I had no MYD88 cells in my spinal fluid. End of story.
Thank you. Thank you all so much. I think it's really interesting to hear the different experiences, and I'm going to ask some questions, but I really want, if there's any questions in the room, we have got a microphone, so please do put your hands up, and obviously people at home, please submit questions too, because this is absolutely, these people have kind of gave up their time, so please do ask them questions. I think there's just one in the audience there.
First of all, thank you so much to our patient panel for sharing their experiences. I know it's not an easy thing to do, so thank you. It just strikes me that we're all different as patients, and we all have different presentations, different experiences. For those of us who've lived with Waldenstrom's for a long time, different challenges, and you never know quite what's around the corner, and then you have good periods. I guess my question is really, it's more by thanks actually to the charity as well, and the work that Alison and Beth are doing in supporting everybody with WM. And I just throw it more to Alison and Beth, I suppose, but just to ask kind of what your vision is for continuing to support patients. We're all different. So it's all about patients for patients' sake. I know you have a patient advisory group now that's building on our experiences, which is helping us to learn more. I just wonder if you could just add a couple of comments about how you see all the support that you're giving actually continuing to enhance our understanding.
Yeah, thank you, Harriet. So I think I'll just say a brief comment and then sort of pass over to you, Beth. So I think, obviously, I set up the support line and launched that. And from listening to the support line, as you've just said, Harriet, there was no one story the same. Everyone has a completely different experience. And I think with that, we've learned that although we want to bring, we want to try and bring a bit of standardization within healthcare to improve patient experiences and outcomes, you also, part of my role is sort of educating healthcare professionals that although we want some standardization, you have to absolutely take each patient as they come and treat them as individuals and really understand their needs and looking at them holistically. In terms of the support that the charity are doing, obviously, as you've mentioned, we've got the support groups, we've got the patient advisory group, who are very much involved in informing us what we can do so that we're meeting needs of patients. One of those things is that what we really wanted to do was, we understand that we don't live with WM, so we can't give that experience. But it's really important for other patients to be able to sort of speak to each other. So Beth, I don't know if you just want to very quickly touch upon the Buddy project that's going to launch soon.
Yeah, so we're setting up a Buddy program in the next few months. There was a idea of one of the patient advisory group because although support groups are fantastic, being able to have that one-to-one, more intense support, especially at the time of being first diagnosed and starting treatment, is really important. So we're setting that up in the next few months. It's really exciting. And yeah, as always, because the support line is continuing to grow. I think I can't remember the exact figures, but I think we've had in the last few months we've had the same number of contacts on the support line as we had in the whole of last year. So that's really exciting. That shows how much the support line is growing, and hopefully that people find it useful. And I think just disseminating information about WM, because hearing from everyone here, you can hear how people who are more sort of informed and educated about the condition, how it's not just an academic thing. It really materially affects their treatment trajectory. The fact that they can have really meaningful discussions with their consultant, really informed discussions, makes a massive difference. So, yeah.
Thank you. And if I could, go on, Keith.
No, we were just saying as well, the day after my consultant said, think about treatment, on her recommendation, though I would have done it myself, I actually found Beth and had a good conversation. Excellent service, tremendous.
We haven't paid him to say that. Just to put that out there. Thank you. I was wondering if I could ask a question, because obviously we've got a poster session coming up this afternoon, and there's one in there by Josephine Foss and her team looking at patient perspectives and experience on treatment. And obviously, Dorothy, you've had chemotherapy, you're now on oral chemotherapy. I was just wondering, what your, do you find that you have a better quality of life on one versus the other? Or what kind of, how do they compare essentially?
Well, it's impossible to compare them. Obviously, the high-dose chemo was grueling.
Yeah.
And when you're going through it, it's terrible. But it got a good, quick result for my disease. So Bing-Neal is very rare, so it doesn't apply to everybody at all. But the initial chemotherapy, which was done infusion as a day patient, I still found it difficult, but I think that was because that was the shock of my first treatment, and I didn't really know anything about it, got no help from anybody. In fact, the 2 months after I was diagnosed, I discovered IWMF, and I just couldn't believe that it was there. And I signed up for their Connect chat line, and they sent me regular paper copies of their magazines, and it was a revelation. And then I discovered there were other people with Bing-Neal, so that was very helpful. But then WMUK started shortly afterwards, and I had a lot of help there, especially from Roger Brown, who's here, the charity's ex-chairman. He got me some very, very useful clinical information, and I've just always had a lot of support since then. But initially, at that stage, when there was nothing, it was very hard.
Yeah.
Obviously, the ibrutinib is just taking pills.
Right.
But the downside of it all is my impaired immune system. It's really bad when my immunoglobulins are low, especially my IgA and IgG, and have been because of the high-dose chemo. And ibrutinib exacerbates that. So I'm on antibiotics all the time, antivirals all the time. And I have a good quality of life, but in the winter I have to take great care. I won't go to parties indoors, go to the theatre or go to the cinema. But after COVID, you don't really mind it so much.
Yeah.
In the summer, I don't worry too much. I always carry gel and a mask, and it's manageable. It really is manageable. And at the end of the day, I'm just very grateful for the excellent treatment I've had. And I do feel, I've had first-class care at UCH. I do really feel for a lot of the people in the rest of the country who really don't get anywhere near that standard of care. And in particular, in Scotland, especially north of Scotland, where it's beyond belief, the support or lack of support that people have. It's very upsetting, actually, because I do keep in touch with certain people, and you just wish you could do something for them.
Of course.
So I'm not really answered your question, have I?
You have. Thank you, Dorothy. But I think as well, so Jeannette, I'm going to come to you, because we've heard of some of the sort of challenges and the experiences in the UK. I was just wondering, from your experiences, have you experienced any challenges with your sort of WM care or treatment? Has she experienced any challenges with her WM care or treatment?
Tiveste novas experiências com a doença? Experimentaste experiência?
Okay. No, my treatment was very good. No symptoms. The biggest challenge of my treatment was the plasmapheresis processes prior to my chemotherapy. It's more difficult.
We were talking before. She had more problems with plasmapheresis.
The plasmapheresis, yeah.
Yes.
Exactly during treatment.
Yes.
Right, right.
The treatment? No.
No treatment, nothing, no complications. Thank you. And I think, Keith, then I'm just going to come to you, because obviously you've had no treatment as of yet, and fingers crossed it stays that way for some time for you. But I think obviously active monitoring is still a really big part of WM care. And how would you say, being on active monitoring for this time, is there any challenges with that? Is there, is there anything that sort of makes it difficult, or how do you feel on active monitoring?
I think it depends on the individual. I must be relatively positive, I think. And so I don't find it a challenge at all. The only challenge is talking to the consultant and saying, I feel perfectly okay, I don't want treatment. And sometimes that, up to now it doesn't work. That's even the last time, because my figures have slowly moved back down to a value which they've told me for a number of years, typically somebody with your figures would have treated by now. But as long as I say, I feel perfectly okay, I don't suffer from any of the symptoms that we've talked about this morning, even fatigue, tiredness. I'm 77, so I do get a bit tired now and again. But talking to people in the support group who have WM, fatigue is the one thing probably everybody talks about. But the regime, I go walking 3 or 4 miles every day. So from a fatigue point of view, in fact, when I was here yesterday in London, I clocked up about 18,000 steps. So without having, without falling over or collapsing. So from that point of view, I'm perfectly fine. So as long as I think I'm convinced myself that I'm perfectly fine, then I'm quite happy.
Cool, thank you. And I think, so just one last sort of brief question, unless there's any more in the room, to Jitendra, because obviously you've mentioned that you're a GP, you're a hospital doctor as well. Did you find that your medical background influenced your conversations around treatment with your clinicians, or do you think it influenced your decision to have treatment, or do you think it hindered it in any way?
Well, I'm fortunate enough to be in 2 places as a general practitioner and a hospital practitioner, and this is a rare disease, very rare disease. And what I found most fascinating was whenever we are given a diagnosis of a very rare disease, and which in my career, I have not seen one, and some of the physicians I work with, I haven't seen a patient with WM. And my catchment area where I work is about 350,000 patients in our catchment area, 152 GPs. And none of us have seen one patient of WM except me. So what I'm trying to say, and that is me as a victim. So it's very difficult. And having sort of gone through it, and when I first started researching WM, believe me, I contacted my colleagues in America and all sorts of places as to what is WM, what do you do there? So when I really came to treatment options, etc., only booklet I had was the one I was given from the cancer center, and that is really quite, what shall I say, unique, that you only get these booklets in a clinic, nowhere else. And thanks to WM and you guys, really, I'm very pleased that the amount of YouTube stuff that we have put on is very useful, not for me, but for my carers who are over there. And I think at one time somebody told me, oh, WM 10 years, yeah. So I think from my personal point of view, I now realize if somebody comes to me with a rare disease, I think the organization at WM or whoever it happens to be is the crucial part. And I still very much urge people to go to these sites, educate yourself. And another thing I found out was general physicians do not treat this condition. So they will not be able to give you the answers you want. Neither could I to my patients. So it's very important that you've got nurses like Beth who can really enlighten you on a bigger picture. And that is one of the learning points for me. And now I have learned that if patients come to you with a rare disease, please put them in the in a situation where they can get more information, especially specialist centers that we have now. And I think that's one of the lessons for me. So that's what I would urge people to do.
Thank you, Jitendra. Thank you. I know that we've overrun slightly and it's lunchtime and people are eager for lunch, but is there any questions, burning questions in the room before we say a really big thank you to the patient panel? Don't think so. Okay. Well, first of all, I just want to say a really big thank you to all of you. As Harriet said, it's not easy to come up here and share your stories, and it's really, it's really nice to have you here. So thank you so much, and just give you a really huge round of applause.